Okay, can you hear me now? I wonder. There you go. All right, so you all can hear me. Good job. Good job. I did a whole intro, and I'm glad I started 2 minutes early because I wanted to get this right. All right, all right, all right. I'm going to do it again. Hello, hello, hello. Welcome to the AMCI 16 week guided YouTube session. And I was saying, hey, I need a mic check. How does my mic sound? How does it sound? Let me know. Go ahead and type in the chat. And in the meantime, I want to let you know that we are ecstatic about 2026. I'm over the moon that you all are here. All right. So I don't want to take too much time. I do want to shout out my amazing team. We've got, you know what? I don't know if they're here on YouTube, but I see them in my chat. I see Mr. Sandeep. I saw Miss Beth. I believe Ms. Mills is here. And I see Star Wars Girl. If you are an AMCI intern, go ahead and let me know in the chat because there are quite a few of you here. Yeah, but I do want to shout out our new members, Miss Yahira. I believe I'm just gonna call you Ms. Martin. Then we got Tanya. We got Private J. I love that. I love that Private J. And then we've got Delicia. Welcome, welcome, welcome. All right, let's get started. All right. And again, I'm just going to say hello to all of you from Team AMCI. Now, let's talk about the purpose of this class. And we're going to be here for 16 weeks. The purpose is not to instruct. No, we've already done the instruction. I'm here to hold you accountable. Yes, I'm your accountability partner, and so too is my team. I want to be more accessible to answer your questions, and I want to review what you should already know, right? And I'm going to give you tips on how to navigate your course week by week. Okay, everybody. And finally, I'm going to point out those key guidelines. Indeed, I'm going to tell you what you need to know. Now, before we get into it, I got some announcements for you. Just want to confirm that we meet weekly at 12 noon Eastern, 11 a.m. Central, and 9 a.m. Pacific. And if you are registered, if you go to our website, www.amcicoding.com, click on the YouTube course and register for the course, we'll send you weekly emails. It's not going to be junk, it's going to be useful. And we're pretty much going to outline what's happening for the week and also give you the direct links so you don't have to look for them. Also, on Mondays here on YouTube, we have guided mastery. This is guideline, ICD-10-CM guidelines mastery classes with Miss Haley, and that's 7 p.m. Eastern. So that's 6 p.m. Central, and what is that? That's going to be 3. Is it 3 or 4? 4 p.m. Pacific. And we also have interactive midterm in anatomy and physiology. We call that IMTAP, and that's Wednesdays at 7 p.m. And you can go there in Discord. All right, 7 p.m. Eastern, 6 Central, and 4 Pacific. And just want to let everybody know that the 2026 MCG ebook is available. It's available. The hard copy will not be available until next month. So the ebook, if you purchase it now, although it's going to say 2026, it is going to convert. It's actually 2025, but it will convert to 2026 at the same time that the hard copy drops next month. It's not a big deal because there are a lot of similarities in 2025 and 2026. So if you feel like you're going to miss something, you're not in a month. And if you already have the 2025, I don't recommend that you buy the 2026. Yes, it helps AMCI if you want to, but I know these are hard times for some. And if you want to be economical, just keep your 2025 manual and there'll be some adjustments. Just make those adjustments. That's all. All right, let's do it. Let's continue. All right, so how to RSVP for these classes from your syllabus. You can find the syllabus on the website, www.amcicoding. From that syllabus. Okay, I'm going to stop and I'm going to let you all tell me how many of you have your syllabus? You've gone to the website and you've downloaded the syllabus. If you haven't, just go ahead and say, it's okay. It's okay. I want to be right here. I want to meet you where you are. I want to make sure you have what you need. And if you don't know, I'm going to ask my team to give you the link to the website where you can register and get your syllabus as well. All right. All that information. Someone said, how to buy the books? I'll tell you, and it's also on your syllabus. Every single thing that you need is on your syllabus. If you have the course, if you are a gold course student, everything is in your course. All right. So if you need information, just go ahead and type in the chat and the team will direct you. All right, so this is a small portion of your syllabus, and this says how to attend the 2026 classes for each week. Now, this is 16 weeks, but I only put the first 8. And these first 8 weeks, we're going to be talking about ICD-10-CM. And later on, you'll see the rest. I just don't want to convolute things. All right. So this is how you do it. You just click on that link. It'll take you here. You'll see this image, and down below, it'll direct you. I recommend that you click on this notification button. This is your RSVP. So you can do them all at one time. Just click them all, click on the notifications, and it will remind you. All right? Next, textbooks. How do I buy the textbooks? What textbooks do I need? They are listed on your syllabus and they are as follows. This official guidelines is not a textbook and we actually provide it for you. So it's there, but you do need it because we tell you to reference it. Also, the Buck Step-by-Step Medical Coding textbook, only the textbook. We don't recommend the workbook, but if you get it, it's not going to hurt. But the textbook, and you can click this link, you can get any year between 2023 and 2026. So don't feel like you got to get that most recent. Nope, 2023 through 2026. Also, you'll need your ICD-10-CM professional or hospital. I recommend hospital because if you decide you want to take the facility, go for the facility certification, this is what you'll need. And they're both the same, except the hospital has more indicators. So I recommend the hospital. I don't think there's a big price difference, or if any. And you can click here. We do recommend Optum, especially if you are going on for facility. If you're not, you just want to do professional, you can get any of the publishers. You can get AAPC, etc. But here's the best thing. And this is new. We're sharing our discount. Optum gives AMCI students a discount on their books up to 50% off. Use it. Here's the promo code. And not only can you buy your ICD-10-CM, HCPCS, you can also get your CPT. And I think it's cheaper. I got mine there and it's cheaper. It was cheaper than Amazon. So go ahead, click that link and use the AMCI promo code. That's because you are an AMCI student. All right. And you're also going to need the CPT professional. You can get that on this link. You can get your HCPCS level 2 on that link. But we're telling you that you can have any publishers. You can. Also, you'll need your MCG manual. If you have 2025, go ahead. Do not buy the 2026. Save yourself some money. Yeah, it helps us, but I got to keep it real. AMCI, we're going to keep it real all the time because there's enough people out there who aren't. All right, so Discord is important. How is it important? What are the advantages? No, you do not have to join Discord, but it does give you some stuff, access to some classes. For instance, that we have a test taking anxiety class. It's in there in Discord. We also have the Wednesday IMTAP. Oh yeah, you got to be in Discord to go to IMTAP. Sorry. Yeah, you got to be in Discord. Also, Friday Night Live, there are, coding game night on Friday, so you can do that. So that's among some of the other things. And the other thing about Discord, the instructors are in there. Yes, they're in there daily. The interns are in there daily, and they are looking to answer your questions. And coming up in 2026, we want to create spaces for you to kind of, talk to your peers and, do what peers do, right? So this is how you join Discord. The instructions are on your syllabus. Follow the instruction. You got to be a YouTube member. Then after the member, you join Discord. You click that link. After you join your Discord, you click this little I call it a cogwheel or settings button. Click it, and then you're going to have to link your Discord to your YouTube. So make sure you use the same exact email. That's where people get tripped up right there. Then just follow the prompts. And if you need assistance, you can click there to watch the video how to do it, or just contact us. All right, amcicoding.com, click on the contact button. And this is all on your syllabus. Now, this is what we're going to do today. And this is on your syllabus. Well, we are going to talk about what you should have already completed. And if you haven't, it's okay. It's not that much. However, there is a prerequisite for this course. You have to have done Introduction to Medical Coding, specifically Introduction to ICD-10-CM. And if you haven't, it's okay, because you can do the work right here. You can watch. If you haven't done it, you can click there to watch the Introduction to Medical Coding. Now, you got a lot of work to do, but I'm pretty sure you can do it. So you watch this, then you'll need to complete all of these other assignments. So watch that, then complete 2, 3, 4, 5, 6, and 7. And if you haven't completed this 2, 3, 4, 5, 6, and 7, it's okay. You can sit back and just kind of chill. If you have already looked at 1, 2, 3, 4, 5, 6, 1 is the prerequisite lectures. It's Introduction to ICD-10-CM. Then we had a playback from the previous session. You're supposed to watch that. Then you were supposed to do your reading, the ICD-10-CM guidelines reading. Also, there was a reading assignment in Carol Buck's book. Then we had this lecture. You can watch the first listed code selection. Then you're directed to read the ICD-10-CM guidelines on outpatient coding. You click there, and then you had a handout. Now, if you didn't do it, let me know in the chat. Let me know. And if you did do it, let me know. I want to know. And if you didn't, just kind of chill with us. Chill with us, and then go ahead and do this. Right? All right. So I don't see anybody saying anything in the chat. Don't be afraid. I'm not going to call you out. I'm not going to say, hey, you didn't do your homework. No, this is me just really sincerely wanting you to have the best of the best. All right, good. Somebody said they did it. All right, so if you're a gold course student, if you're a YouTube gold course student, the only difference is it's not a big deal. They have an LMS. They actually have a course where we put everything where it needs to be. Whereas if you're not, you just kind of got to navigate things on your own, but we did our best with that syllabus where you can just click the link and get what you need. All right. All right. So this is the gold course. Now, what you should already know. I'm going to get right to the meat. What you should already know for today. You should know general ICD-10-CM coding guidelines, right? Number two, you should know how to select the first listed code. Number three, you should know where the guidelines for the first listed code, where they're located. You should know the first listed guidelines pertain to outpatient and professional coding. So whenever we say, hey, what's the first listed code? We are coding for outpatient or professional coding. And finally, you need to know that the principal guidelines pertain to inpatient or facility coding. There is a difference, a big difference. All right, somebody says, how do I go? How can I change? You can do that through YouTube. It's a very simple process, but if you reach out to us, we can tell you, you just do it through YouTube, click on your settings button and follow the prompts. I think it's under membership. All right. So this is how you self-assess. This is what you should already know. And I'm going to do this every week. I'm going to say, hey, you should know this, this, and this, and this. And if you don't, then that's how you self-assess and you know where to go. All right. Now, today, I'm going to test your knowledge, right? Yeah. So let's see what you know. And nobody, we don't judge here because we were all where you were. Every last one of us was where you were. And I really want to emphasize it is okay to get it incorrect because ultimately, that's priceless. You're going to learn. It's going to be an aha moment. So don't be afraid. Let me know what you know. Okay. And it helps me adjust the instruction. All right. All right. Put your answers in the chat. What is a disease or illness that's named after someone or something called? Go ahead, put your answers in the chat. And I'm going to tell people that all answers are good. So it doesn't mean it's correct, but all answers are good because you took the initiative. I see some answers in the chat. All right. So the majority of you said eponym, and it is. So an eponym is a disease or illness named after someone or something. Okay, coders. In your instruction, in the lectures that you should have watched prior to today, we say that there is a hierarchy whenever you're selecting the I would say the main term. There is a hierarchy. So if you have multiple words, there is a hierarchy in terms of which one of those words will be your main term. And this is your main lookup term, right? So in our hierarchy, where does an eponym fall? Is it first? Is it second? Or is it third? Go ahead. Let me know. Do you know? So when you have multiple terms, and here's an example. If you have, I'll say, Trojan's syndrome. Trojan's syndrome. There are two terms. You have Trojan's, which is your eponym, and you have syndrome, which is another term, and that's a diagnosis, right? So you got Trojan's syndrome. Which in the hierarchy does the eponym fall? Outstanding. It is first. Anytime you have an eponym, you look up that term first. And if you don't know what I'm talking about, you will when you go back and watch the lectures. Way to go, way to go, way to go. Okay, I got another question. This abbreviation is used when the ICD-10-CM system does not have a code for that condition. Go ahead, type your answers in the chat. And I just want to shout you all out, just rocking it. And my intern, Miss Star Wars Girl, I see you. I know who you are too. All right, so she is just cheering you on and you're just rocking it. And I see people from last session. I just want to welcome you back, Miss Zolma. I don't know, I may have pronounced your name incorrectly before. Um, Hi, Miss Rosa. Hey. Okay, I see if you have AMCI medical coding, I don't know who you are. That might be Ms. Mills. That might be Mr. Sandeep, but I just want to say, hey, 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 Melissa. And look at you. Look at you. Look at Vina. Okay, Vina. We've got Valen. Okay, I see user IY4S. That's the way to do it. Hey, Miss Haley. Okay, everybody. You know what they're saying in the chat? They're saying NEC, not elsewhere classifiable. That means that the doctor said the patient has this condition, but it's not in the book. So there is kind of a generic term or generic code that you can use, a general code. Great job. All right, got another question. At AMCI, we use this term or this acronym RFE. It's an abbreviation or acronym, I would say, used when you are identifying the first listed diagnosis. Okay, coders, what is RFE the acronym for? I'm excited too, Fire Phoenix. Okay, Delicia. I see some good answers. Melissa answered. If you answer, I'm going to shout you out. All right. Hey, user SW4ZS. Outstanding. All right, Dashimia or Dashima. Dashimia. Tell me if I said it right. Dashimia. That's right. The coders are killing it. Okay, Janet. Okay, Matthias. Okay, everybody, you know what? You know what they all said? 100% of them said reason for the encounter. I want you all to remember that reason for the encounter. We're going to talk more about that today. This is the first listed code. How am I going to say this? The reason for the encounter substantiates first listed code selection. Okay. Hi, Shaquita. Welcome, welcome, new member. Okay, so we're going to let that marinate and then we're going to come back to it. All right. Got another question for you. Go ahead, put your answer in the chat. Where are ICD-10-CM guidelines on first listed code selection in the ICD-10-CM manual? Where are they located? We know they're in the index, right? But under what section or where is it? If you know, go ahead, type in the chat. If you don't, we're about to have an aha moment. Okay, Dashima, I got you. Thank you so much for the phonetic too. Hi, Nicole. Welcome, welcome, welcome. Look at Vina. Hi, Mr. Sandeep. I see you. Good try. That's right, Zoma girl. Go ahead and put it in the chat. I see you. Fire Phoenix. Hi. Ooh. Ooh, I wish I could say Vasav. That's what I'm going to say for now. Correct me, please. Okay, Matthias, Zoma. Okay, guess where it is? It's in section 4. So when you hear people talking, section 4 guidelines, these are the guidelines for first listed code selection. These are the general guidelines for selection of that first listed code. And first listed code is for outpatient or professional coding. Good job. All right. So now you all might not know this, but First listed code selection guidelines are in section 4. Where are the principal code selection guidelines located? Do you know? I'll give you a little time, but if you weren't quite sure about first listed, because that is our bread and butter, right? This is really for the people who do facility coding. Look at that. Delicia, you know what she said? She said section 2. Absolutely. So the facility coding guidelines are in section 2. And also, just so you know, section 3 is where the facility's other coding guidelines are. So section 2 is for that principal, and then all other guidelines for a facility is in section 3. So I'm going to say for all other codes or secondary codes. Hopefully that makes sense. All right, so now that we gone over those, we kind of did a little review. Now we're going to hone in on something that you really should know. You should really know how to select that first listed code. So we're going to do a challenge, and I really don't just want you to know how to select the code. I really want you to know the guideline that directs that code selection, the rationale that you're using. I want to develop you thinking about guidelines, and everything that you do should be backed up with a guideline in this class. All right. All right. So here is the first scenario. And as you can see, I did put the code language at the code. We don't typically do that, but I'm doing that for time's sake. And the answers: A, D50.0, iron deficiency anemia secondary to blood loss. B, N92.0, excessive and frequent menstruation with regular cycle. C, R53.83, this is other fatigue. And D, D64.9, anemia, unspecified. A 48-year-old female presents to her physician's office with complaints of fatigue, dizziness, and pallor. The provider orders lab tests which reveal iron deficiency anemia due to chronic blood loss from menorrhagia. The patient is treated with iron supplements and referred to gynecology for further evaluation. Okay, coders, what say you? Is it A, B, C, and D? And then I want you to really think about why. All right, you all are killing it in the chat. Thank you, thank you, thank you for for the effort that you are taking. Always think about why. And if you want to put in the chat why you say your answer, that would be great. I just know you all are on fire. And if you don't kind of know, just feel free to kind of sit back and watch, right? All right, this is how we did it, and this is how hopefully they did it. All right, so what we do is when we're solving these scenarios, we do what we call an inventory. And if you've watched the lectures, this is not foreign. So what is an inventory? Inventory is we write down all diagnoses, all signs and symptoms, and procedures. And I do it in the order presented. So the first thing that came was fatigue. Next, dizziness. Next, pallor. Then the lab tests revealed that the patient had iron deficiency anemia due to chronic blood loss from menorrhagia. And then I put here that this patient was treated with iron supplements, right? So we're going to say procedures or treatment are synonymous, right? And I'm going to get rid of the signs and symptoms that are related to any diagnosis on this list. So we've got Fatigue, that's related to the anemia, the blood loss, and menorrhagia, right? So too is dizziness, and so too is pallor. And if you don't know what pallor is, that's, skin, their skin is pale, paleness in skin. So all three of these are related, so we're going to get rid of them. It's kind of a distraction. So I've got iron deficiency anemia, and I've got this chronic blood loss, and I've got menorrhagia. Which one should be first listed? And then we got a gem. See this gem over here? This is what we call little gems, little tips. So if there is no guideline that tells you what to do, the chief reason for the encounter, or the RFE, the chief RFE, means what was chiefly treated. In other words, what was chiefly treated will be your first listed code. I'm going to let that marinate. So the patient was treated with iron supplements. What does iron supplements treat? Does it treat anemia? Does it treat blood loss? Does it treat menorrhagia? It treats anemia, right? So blood loss will be treated with something else, maybe coagulation. So too with menorrhagia. I don't know. But you don't use iron. Iron's treating anemia. So that's going to be our first listed code. So we can go ahead and get rid of what is not codable. So we're going to get rid of the excessive and frequent menstruation. We're going to get rid of the other fatigue. We could have gotten rid of that right away. And we're left with A and D. And you know what? A is more specific. Iron deficiency anemia, secondary to blood loss. Although we're not coding blood loss first, we are going to consider it definitely. This is a combination code. It is much more specific. It has a higher level of specificity than anemia unspecified. In fact, anemia unspecified would be incorrect because the doctor did specify the type of anemia. So we're going to get rid of D, and A is your answer. And, judging from you all knocked it out the park. Okay, I see you health messages. All right, I'm happy you're here too. So the answer is A. And if you got that correct, outstanding. Okay, somebody said, hey, I said A because the blood test revealed it. Same thing, too, because that is the chief reason for the encounter. The blood test was working towards that diagnosis of anemia and the treatment. But the key word, make sure you focus, if it's available, treatment. If there's no treatment, of course, the tests and whatever you need to determine what was chiefly treated. Outstanding. All right, let's do it again. We got to redo. You all ready? For those of you that are here on your cell phones, let me know how the view is. Let me know how it's going. This is something new. All right, so of the following answers, which best describes the encounter? A, R10.11. This is right upper quadrant pain. B, K80.20. This is calculus of gallbladder without cholecystitis, without obstruction. C, K81.9. This is cholecystitis unspecified. And D, Z01.89. Encounter for other specified exam. A 60-year-old male is referred to radiology for a CT scan of the abdomen due to right upper quadrant abdominal pain. The scan reveals multiple gallstones, but no evidence of cholecystitis. The patient is instructed to return to his primary care provider for follow-up. Okay, coders, what say you? Go ahead, type your answers in the chat. Someone says how to make your screen bigger. All right. So the reason it's smaller is because you probably selected the link for the cell phone for the mobile device. So I would suggest maybe team, if you could put the link for the main YouTube page and they could click on that, or you can just go to YouTube and select the one that doesn't have the little mobile device next to the title. All right. All right. So I'm just, you all are killing it. All right. So everybody in here that's answered, be honest. Let me know. Did you attend the first 16-week course? Because you all are amazing. All right. Somebody said, no, I didn't. You're just amazing on purpose. That's what I'm talking about. All right. Stephanie said, no, but welcome, welcome. Val, oh, she said, absolutely. I love it. Well, you all keep going. Keep going. All right, let's go ahead and get to the answer. We did our inventory. That's your diagnosis, signs and symptoms, and procedures or treatment. The first, I put CT scan of the abdomen. That is your treatment. Then this patient had a right upper quad abdominal pain. Then multiple gallstones. Then the doctor said, hey, there's no cholecystitis. And the CT scan of the abdomen is the treatment. That's important. And I'm going to go ahead and get rid of this right upper quad abdominal pain because it's related to multiple gallstones, right? And I'm going to get rid of it in my answers just because it's just, it's a distraction being there. Now I've got a gem, and this gem says, if the documentation says that something is not found, then you do not code it. So let's go ahead. Since there's no cholecystitis, let's go ahead and remove all answers that have cholecystitis in it. Gotta go. And that leaves us with B and D. Now, what about this encounter for other specified exam? That could be first listed. However, if you go to your selection of first listed code chart or your guidelines in section 4, it says under diagnostic procedures, use Z0189 for routine lab and radiology testing when no diagnosis is found or the patient has no other diagnosis, right? So we got a diagnosis. We have gallstones, so we cannot code Z0189, and we're going to get rid of D because we have a diagnosis. And if you didn't know, calculus of the gallbladder, that's stones. And that's a reason why medical terminology is good, because if you didn't know that, you may have been reluctant to select that code, but you do now, right? Okay, so if you said B, like all of you did, outstanding. My purpose today is not to make it easy, but I'm giving you the tools to reference guideline and substantiate your answer. So you could just come out and say next time it's B because Z0189 guideline in first listed section 4 guidelines say you don't code that whenever you have a diagnosis. I don't know. We're elevating. We're elevating. So I just want to shout you out. Outstanding. All right, we got another scenario. Y'all ready? Okay. Of the following answers, which best describes the encounter? A. E11621, type 2 diabetes mellitus with foot ulcer. B. L97.409, non-pressure chronic ulcer of heel, not otherwise specified or non-specific. C, Z51.81, this is encounter for therapeutic drug level monitoring. D, E11.40, type 2 diabetes mellitus with diabetic neuropathy unspecified. Now, this is not introduction. No, this is advanced. And actually, we'll be targeting these in the next 2 weeks. This subject, we're going to bridge this subject. All right, here we go. Here's the scenario. A 55-year-old female with type 2 diabetes mellitus and diabetic neuropathy comes to the outpatient infusion center for IV antibiotic therapy to treat a diabetic foot ulcer. The provider does not evaluate her diabetes during this visit. Okay, coders, go ahead, type your answers in the chat. All right, I see some amazing answers in the chat, and I'm going to tell you something. This question was designed to demonstrate how we move from beginners to mastery. In beginners, we study general coding guidelines. So if you've never studied specific coding guidelines, you should have said B. But if you did, you would have said something else. Now let's get into it. All right. So, inventory, type 2 diabetes mellitus with neuropathy. Number 2, this patient came in for outpatient infusion of antibiotics. Number 3, this patient has a diabetic foot ulcer. And number 4, the doctor did not evaluate the diabetes mellitus. Now, I just said if the doctor doesn't treat it, you don't code it. However, if there is a specific coding guideline that supersedes it, then you will follow it. And you know what? Even if there's a general coding guideline that supersedes what I just said, then you follow it. All right. So there is a guideline. There's a general guideline, right? So if the doctor doesn't find something, then that means you never had it. However, if you have a chronic condition at the time of that encounter, the Section 4 guidelines say, hey, anytime you have a chronic condition at the time of the encounter, or a condition that typically chronic conditions, and it affects the patient's treatment, you must code all of them. So if a patient comes in with a broken foot and still has diabetes, that diabetes coexists at the time of the encounter, and it could impact the encounter, right? Yes. What if this patient has diabetes, is on medication, right? So that doctor has to look at the entire clinical picture. That doctor has to do a little more work than if that patient was just a young person with no chronic illness. So you've got to mention all chronic conditions whenever they have them. All right, so I just thought I would tell you that. So what I just said about if the patient doesn't have it, don't code it, that's correct. However, if if the doctor doesn't treat a chronic condition and the patient has one, you do code it. But it doesn't mean it's first listed. Just thought I would tell you that. Now, let's go ahead and look at these therapeutic services. We did have a therapeutic service. This patient had outpatient infusion of antibiotics, right? So, typically, when a patient has um, therapeutic services, it's not first listed unless if the patient has chemo, radiation, or radio beam, right? That could have thrown somebody off. So I just thought I would point that out. These encounter codes will supersede, you will code for the encounter code if they have chemo, radiation, and or radio beam, and you'll sequence that first. But we're going to learn about that when we get to cancers and malignancies and neoplasms, right? But I just thought I would point that out in case somebody said, hey, this patient had this infusion and we should code this encounter. No, you never code an encounter unless it's for chemo, radiation, or radio beam. So they did not evaluate diabetes mellitus. It doesn't matter. It coexists at the time of the encounter, and this infusion should not be sequenced first. So we're going to get rid of these distractions. All right, now this is where you elevate. So we've been looking at general coding guidelines, and if you've never seen a specific coding guideline, welcome. All right, so this is just for demonstration purposes if you haven't seen it before. All right, so what you see is the guidelines for diabetes mellitus. General coding guidelines are guidelines for specific illnesses and injuries, and there happens to be guidelines for diabetes. And one of the things you need to know is that diabetes codes are combination codes that includes the type of diabetes mellitus and the body system affected and any complications. In other words, these combination codes are very specific. And you are directed to use as many of those codes that are applicable. So if we have a ton of answers that says this patient has diabetic foot ulcer, the patient has diabetic neuropathy, the patient has all these diabetes. If the patient has all those related complications, you should code them. But our task is to sequence first. We need that first listed code. Why did that patient come? Well, that patient came because they had a foot ulcer, right? But your diabetes code will take precedence over that foot ulcer because you'll use the diabetic complication code for foot ulcer. All right. So we're going to get rid of that encounter code. It's a distraction. And we are going to code E11.621 diabetes mellitus with foot ulcer. Now this non-pressure chronic ulcer, I changed it and I didn't change it on this thing, but it did say non-pressure ulcer. It was a non-specific, so I do apologize for that. But we would code this secondary. It would not be first because you've got your diabetes. Okay. Now I know it may be a little difficult to understand at first, but you'll come to learn that when you have conflicting guidelines, like which one do I use, you will always follow the specific coding guideline. It will take precedence over the general coding guideline. So when you come to these diabetes guidelines, you're going to follow them first. All right. And the answer is A. So if you said B, welcome, welcome. You just had an aha moment, and I'm proud of you. If you said A, outstanding. Way to go, way to go. Welcome, Jamie Smith, new member. And thank you, Miss Beth. Miss Beth is one of our interns too, and she is amazing. I'm hearing great things about all of them too. All right, so let's go ahead and finish this up. The answer is A. All right, so now we're at the end of our session, and these sessions are going to be 1 hour long. There's no need for me to do instruction because we already did the instruction, and you can find it on your syllabus. So week 2, this is everything you'll need to know before next week, and we're going to test your knowledge just to make sure you're right on task. Well, next week you should watch the playback here, right here. Then you will watch the playback. Oh, excuse me, this is a handout. I apologize. Download the handout from last class, not pertaining to this, but last sessions, last year. Click that handout. Then watch the playback. It's going to give you more instruction. Then you read your official guidelines because we're going to start talking about those specific coding guidelines for HIV, sepsis, MRSA, Zika, and COVID. Then we need you to read your guidelines here. And then you can you read it from the MCG manual. You can purchase it here. Then you have a reading assignment. Go ahead and read Carol Buck's chapter on these infectious diseases. Then I need you to watch the YouTube lecture series. It's in the playlist. So we got this playlist. In the playlist, these two are the same. So everything in the playlist is in the order that you should be looking at it. So if you said, hey, I don't want to follow this, I just want to follow the playlist, just go in order. Okay? Then watch, we have a TAP lecture for you, and that's from your MCG manual. And then there are additional infectious diseases practice questions. It's in Discord. If you are a gold if you're a Discord, you have to be bronze or higher. You can see that. And also, if you are a gold course, everything is in your course. You don't have to do anything, just push the button. Everything is where it needs to be. Now, if you purchase the optional Bucks workbook, go ahead and do that. I don't recommend the workbook because we want to keep costs low, right? This is a free course. Let's keep it as free as we possibly can. Again, gold members with the course, follow your LMS in order. And if there's anything that you need, gold members, if there's something you see that may not be there, let us know. We'll get it right away. All right, so here are the final tips for you. Remember, this class is not for instruction. The purpose is not to instruct. We're going to instruct smarter, not harder. We've already done the instruction, but we're going to use this opportunity to augment what you already know. You don't have to remember guidelines. Don't get balled up and say, oh, I got to remember this. No, just know they exist. Just know that there are guidelines that exist. And we have a technique called TAP, and you will be directed to tap your manual. And that tap is a way to remind you that there's a guideline for that disease. Also, use your Quizlet to study the guidelines. There's a Quizlet. There's going to be a Quizlet in your homework. Definitely use it. Never use an encoder. Never. ChatGPT is an encoder. And we see people telling people to use chat to generate questions. Don't do it. I promise you, don't do it. I use ChatGPT. I use other AI to generate questions, but I'm always having to correct it. And you already saw one of the errors that chat made. I always have to correct. I would say 75% of the time they make an error. They're just not, it's not there yet. So, you got to work smarter. So never use an encoder. It will thwart or stop your independent coding proficiency. Don't do it until after you've passed your medical coding exam. You want to have that skill of looking up that code in that manual because you're not using um, encoders on your exam. Until we start using encoders on the exam, never use it. All right? Never use that blind process of elimination. Some instructors will teach that. I do not recommend that because I'll tell you why later. I'll demonstrate why. Because it can work, yes, but are you really learning how to code or are you learning the technique? And that blind process of elimination doesn't work when you go to take those pre-hire exams. They want to know what you know. And if someone is teaching you that, then they might not be teaching you how to code. They might not be teaching you the fundamentals. All right, 2026 guidelines. If we have something in our lecture and there's a conflict and you have a 2026 manual and it's, conflicting with our 2025 lecture, then that 2026 book or guideline is going to take precedence. Rest assured. You can let us know that there's a conflict, but don't be confused. You got it. Just know 2026 is going to take precedence. And finally, a lot of people are doing Practicode. If you're in another course, a lot of people are here in other courses. If you're in another course and your course says do this Practicode, I'm going to tell you not to do it until after you've passed the exam because Practicode is a distraction. It's designed to prepare you for the real world and remove your CPC A. So right now, while you're taking this and preparing for the exam, I'm finding that to be a huge distraction. So do not wait. If you can, wait, please. And that's it. All right. So we'll see you next class. I want to thank all of you. I want to thank my team, Miss Star Wars, Miss Haley, Mr. Sandeep, Ms. Mills. Come on, come through. Show your face because I'm going to miss you. I know Miss Chard. Come through, say your name. And I do apologize. I'm bad with names. Okay, Case, I love the way you spell your name, Ms. Rosa. Thank you, thank you, thank you. And to all of you, there is a survey in the chat that my team is going to put in there. Please put the survey, please fill it out, let us know. And if you are not registered for this class, you might want to so that you can be kept looped in if we have any changes, etc. I don't foresee too many, but we will be sending you reminders about what happens this week. Don't forget Mondays. Attend that ICD-10-CM course. Amazing. ICD-10-CM guidelines. It's on YouTube, 7 p.m. And that's it. So we've got like 1 minute, and I want to just see if you all have any questions. Let us know. Fill out that survey, please. If you have questions and you didn't really get a chance to get the question, your question answered, or you just don't want to share it with everyone, put it on that survey. We're going to read it. All right. And if I need to, discuss it next week, I'll start early and I'll get in there and address it. All right. So I just want to thank all of you. And Cangelus, oh, I know I probably butchered that. I'm sorry. But Casey, your name is so cool. Linda, how are you? Okay, everyone. I want to thank my team, Fire Phoenix. You are incredible. I remember you all. Tanya, I see you. She said she had a great first day. That's awesome. Someone said, are we going live on PCS? Absolutely. Ms. Britters, that's next. After this session, PCS. Someone said, I'm not gold with LMS. Should I upgrade? It's up to you. The LMS is what it is. It puts everything in order. For me, I would need that. But you might not need it. You might say, hey, this sheet is good enough. Okay? Awesome. Okay, everyone. I want to say have a wonderful, wonderful week. I can't wait to see you next week. Let me know if you need anything and have peace. All right, everyone. Take care.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI